Good morning and welcome to 65 Aesthetics. We're live in clinic. The patient's just cleaning up. We're just going to go live on TikTok as well. So on YouTube, you'll just be live with us all day. You're going to see some things that we're doing today. We're treating hyperpigmentation, which is going to be pretty exciting stuff. So we're using PRP and PRF to treat hyperpigmentation. This is the patient's third go, so you're going to see what it's like in a second. She's just popped to the toilet. We're going to have a quick look at what we've done over the last two sessions, and then we're going to straight go into treating her again. So if you don't know much about PRP and PRF, the only thing that you've missed is the taking of the blood. So we've taken her blood and we've spun it into a centrifuge. We've spun it at 700 RPM. Now the reason why we've done it at 700 RPM is that we want the growth factors. So we want the vibrant in the blood, and I'm going to show you that now. So this is the blood that's come straight out of the centrifuge, and if you look closely, it's that orange stuff. This live is in Brentwood in Essex, so you can see that vibrant, that bright orange stuff at the top. That is her vibrant from her blood, and that's the bit that we're going to inject in her when she returns. Oh, excellent. Do you want to have a seat, Nick? So here's our patient who's just arrived. This is Nick, and I'm not sure if you'll be able to see this on YouTube, but it's this pigmentation around here, which is the bit that we're doing. Can you hold that nice and still for me, because that can't move. That's the areas that we're going to be targeting today with her blood. We're also going to do PRP. So PRP, we spin it much faster than PRF, and you'll see us do that as well. So if you're on YouTube, I'm not going to be very interactive with you guys, but if you're on TikTok, then I'm going to be. Nick is going to answer the questions, or tell me what the questions are so I can answer them. I'm on my own today, which is going to make it a bit challenging. Normally there's a nurse with me, so the two of us can do it together, but we've got a bit of a challenge today. Right, so we're just going live on TikTok. Can you just hold that like that for me, so I can... Perfect. So what I'm going to do, I'm going to take the vibrant from here and get it into a test tube so that we can inject it back into her face for that hyperpigmentation. And then you'll see me do that. So if you're on YouTube, then obviously I can't answer any questions, but if you leave any comments with any questions, I can answer them. Good morning from everyone at TikTok. I hope you're well. You've just joined us. The only thing you've missed is the taking of the blood. So we've got PRF going on first. So if you look at that bright orange stuff here, this is the bit that we're looking for. So this is not PRP, this is PRF. And I'm going to get that into a syringe really quickly. We have about 15 minutes before this goes off. So we have to act really quickly with this stuff. Otherwise it goes off. And out of all of that blood, we literally have got that much. So it really is gold, as you can imagine, which is what it's called. It's actually called liquid gold. So I'm going to spin the rest of her blood in the centrifuge for PRP, and then we'll be able to crack on with what we're doing. So, if you just join us on TikTok, good morning everybody. Let's have a good look at this patient's face. So this is her third treatment for hyperpigmentation, and you can see the areas that we've been treating. This was all brown 3 weeks ago, and on this side you can see here the pigmentation. To be honest, it's getting less and less, but this was quite dark before, wasn't it, Nick?
Yeah.
So you can hardly see it on this one, which is really exciting. So unfortunately I'm on my own today, so we're going to flip this camera around so you can hold it and see what you're doing. So if you hold it like that. So that's our patient Nick. She's agreed to go live on air for us. We're going to start with the PRF, which is the fibrant. Now the reason why we're starting with PRF is because I have to be quick to do this, because it doesn't last very long. So within a few minutes this becomes really thick, and we're just superficially sticking it under that skin. No pain?
No.
So in it goes, just slowly putting it in and rubbing it out. So this is the first part of the process. So we're doing this while the other stuff is cooking. If you've got any questions, let me know. Nick can relay it to me. So that's the PRF in her face, which is really good news. And that's all done. Now PRF, you'll know PRF through what the dentists do. So dentists will tend to use PRF for growing bone. What we've used it for is just sticking it on that cheek there for the hyperpigmentation, and then on this side here just to get rid of that. I'm going to change my gloves. We're just waiting for the other blood to be cooked, and then we'll get that processed live in front of you. This is Nick's third go with hyperpigmentation, and talk us through, Nick. I mean, you've had it obviously a long time. When did you first notice it?
The one on the side I've had for a long time, underneath the eyes, and maybe the last year or so.
Last year or so. And we think it's down to sun, maybe, just lack of care and interest before. I mean, we've all done it. I mean, we've all done sunbeds in the 80s, haven't we? Let's be honest. And of course, there's no other real treatments for it. I'm just going to clean that blood up and then just sort of face out. So this is the side here that we've been treating. The redness, the dark here was a long dark streak, wasn't it? And it sort of came down the cheek. Yeah. And you can see how much we've got rid of. This is the third treatment, and I think we're really close. You've never had a sunbed, is that one of the things that they've said? Yeah. Well, luckily you then. I tell you, you don't want to have a sunbed. I'm just checking the blood. So we've got about 6 minutes until her blood is ready. So I'm just going to try and stop this bleeding. And then what we're going to do with the PRP, we're going to concentrate on this area, and obviously this area. And because we've got some blood left over, we're going to treat our hairline. Now, you can see some little baby hairs here, Nick. Fantastic. Yeah. All on the scalp. And this is just purely by pulling her hair back. So whenever we're treating anything with blood, we don't necessarily just treat the one thing that you've come for, because, you know, if we've got your blood out, we might as well treat other things. So with Nick, although it's hyperpigmentation that she's here for, we're treating that hairline as well as part of what we're doing. I mean, how have you found the process?
Yeah, it's been fine. Yeah.
You got a bit worried at one stage, didn't she, bless her? She Googled something on Google, and I think whenever you Google anything on Google, it can send you down a rabbit hole you don't want to go down. But what we've been doing with this treatment, we've been injecting and microneedling, and I think this was the worst side, wasn't it?
Yeah. This
was the worst side by means. This redness is purely the PRF that's just gone in, which is her fibrant. What question is that? Does the hairline come back? Yes. So what we've done with her, we've injected all along the hairline, and you're going to see me do that. But actually, she wasn't here for that. So that's just an extra that we're doing because, yeah, I bet you want it. Yeah, come and see us. That's what it's all about. So that's why we're showcasing this. The other thing that you've probably noticed, Nick, have you noticed that your skin's better overall?
Yeah. Yeah, it's a lot better.
So,
and the lines as well. Remember the lines?
oh yes, sorry, I forgot all about those. So if you smile for us, so Nick used to have these long lines coming down her face here. So what we used to do with Nick was we used to use filler. So every 2 or 3 months we would fill these lines with filler. And of course you don't really want to do that. It's not great. So we've used her blood and we've made it nice and thick and filled that into these areas here, and that's worked really well, hasn't it? That really has worked well, and it's on both sides. I think, from smile for me, so down there as well. So that's the beauty of this. I think someone asked where we're based, didn't they? So we're currently in Brentwood, but we also have a clinic in London. So central London and Brentwood is where we're based. We're 4 minutes away from being able to process it all. If you've got any questions, then please ask us, and Nick will relay the questions on my behalf. I'm just busy getting some needles ready. We're going to be using Botox needles today. So these are the needles we're going to be using for injecting the blood, and then we're going to microneedle as well. So we'll microneedle the PRF and also inject it. You're going to see it all today live. If you're on YouTube, I'm sorry, I can't. We normally have an operator operating it, but I can't answer any questions whilst I'm live. But if you drop us a note, then we'll do that. Nick will deal with any questions on TikTok. Has there been any?
No.
No? Good. And off we go. So if you join us on, let's have a quick look. Where are we? We're based in West London and Brentwood. We're dealing with hyperpigmentation, and you can sort of see here what we've been doing, which is just fantastic. If you're calling me, can you please stop, because I'm live. This is what always happens. So I will, if you drop us a message, we will speak to you after. One of the secretaries will speak to you. So we're going to use 10 ml syringes. So when I get the blood out, which is going to be about 2 minutes, we'll fill one of these up. And what I'm going to do with this, Nick, is I'm going to give you this to take away. And I want Nick to concentrate on this area, because out of the 2 areas, it's this one that doesn't seem to be going as fast as these areas. So I want you to concentrate on that at home. Is there any questions?
Are they individual injections, or do you do a course?
So it's a course. So depending on how bad the hyperpigmentation is, with Nick, we've done 4. So this is her 4th one coming, and it will just depend on where you are. What we do is we just charge it according to what we think it's going to be. So Nick's paid $495 for her face. Over 2 treatments. So yeah, it's not bad, because once it's gone forever. So that's the other thing that you must remember. Once the hyperpigmentation is treated, then it's gone forever. So if you're on YouTube, I apologise that I can't talk to you individually, but please bear with us. Right, 1 minute to go, and the blood will be ready, and then we'll start to show it. Any questions on TikTok? No. If you just joined us, welcome to 65Beauty. I'm on my own today. Beela's gone to her university, believe it or not, because I think she qualified in university during COVID, and they're doing the graduation now for some reason. Personally, I wouldn't have bothered, but then that's just me. Any questions about hyperpigmentation? Yeah, it's good, Lorraine. I tell you, normally I'm so busy videoing the nurses these days, I rarely do treatments myself, but it's just nice to be able to do it whilst Beela's away. All right, this is almost cooked. We're 30 seconds away. Let's get this out. So we're using a Joan Lab LC500 centrifuge, which is one of the top of the range models, and we use this because it gives us the most static results. People think when you have centrifuges, a centrifuge is a centrifuge, but it really isn't. You can get good and bad ones. I think you can even buy centrifuges off Amazon, believe it or not, but I don't think I'll be doing that.
So someone said, what treatment are you doing? And someone else says, I have crow's feet and droopy eyelids with this.
Yes, yes, it certainly would. So, YouTube has gone all funny. Sorry, guys. So here is the stuff that we're going to be injecting today. So what you can see here, we've spun the blood and we've now got the PRP at the top and then her red blood cells at the bottom, and that's what we're going to be injecting into her face today. So we've got 4 tubes to go. So sorry, YouTube, I'm on my own and it's really tough to try and do this by yourself. Good. You can see the patient. There you go. So we're going to be injecting in a minute. So if you just bear with us on YouTube, and you'll be seeing this live. If you're on TikTok, I'm just going to prepare the blood. So I'm taking syringes like this. So basically Botox needles. So it's nice and tiny. This is 1 ml syringes, and we're going to put this her blood into these syringes. Some gloves on, and then we will be injecting. So Nick, talk me through obviously your skin journey, because we've done a fair bit with you, haven't we, over the period? But this has this changed everything for us, hasn't it? And we're now doing more of this than anything else, I think. I mean, how have you found it?
I think it's great. I like how my skin looks without makeup. I was always wearing foundation like what I told you before.
Yeah.
Even just to go to the gym, whereas I've not been doing that as much now. I feel more comfortable.
So for those on YouTube, so we're now taking this blood out of the syringe, out of the vial. So we're just extracting the PRP into the syringe. So you can see that there's her blood now being processed, and we're just taking that out of the syringe. And this is for hyperpigmentation. We can do so many different things with this product. So you can do everything from hair loss all the way through to hyperpigmentation. It replaces skin boosters. It replaces really everything. So on TikTok, this is what I'm just doing. So because I'm on my own, it's a bit more tricky to try and do all of this by myself, because normally, as you know, we've got a nurse here. If you bear with me, we wanted to show it live as well as doing it there. Right, let me just get this positioned properly. Okay, so we're going to start. So if we have a look, this is just a normal syringe, and what I'm doing is I'm going very superficially into the skin. So for 2 reasons. One, because we don't want to affect anything to do with nerves or arteries or anything like that. So we're going parallel to the skin. We can actually see the PRP under the skin, which is what we want. We don't want to go too deep with this. We want to keep all the blood. So it's very strange that you end up wiping blood into a patient's face, but that's purely because we want to keep every bit of goodness of this treatment for her. And then we're just going to go around those sides. So here, if you just joined us, we're treating hyperpigmentation live on YouTube and TikTok by myself, which is making it a nice challenge, to be honest, Nick. Nick will read out any questions that you've got. We're also going to treat her hairline. So if we look at this other side that we're doing, so you can see the pigmentation that's left. When we started, all of this was pigmentated, but now you can see that it's really just tiny little bits. We can also do this for rosacea. So if you suffer with rosacea or eczema on the face, this treatment also helps that. It's completely painless. So if you're wondering about it, Nick, can you feel anything?
No, not
Just
really.
the slight, the needles going in. What's the question?
What is the downtime?
0. So Nick, talk to me about, obviously you've been here 4 times now. What's it like after the treatment?
It's a bit red.
Yeah.
And then within a couple of hours, it seems to have gone similar to Botox, I guess. If you bruise, you bruise. But last time it was nothing. It was a bit
Yeah.
red when I left, and then it was fine after. By the time I got home, it was fine.
You had a few bruises, I think, on the first one,
time.
didn't you? Because we were going a lot deeper on that first one.
Yeah.
So depending on obviously what we're treating and what we're using this for, will vary the depths of it, and we vary the needles that we're using. At this stage now, this hyperpigmentation is so minimal that we can be nice and shallow with it. So we'll show you hairline now. So what we do with this, because it can be quite painful, we can just flick between doing hairline versus doing face, and that way it just gives the patient a bit of relief rather than keep injecting the same area. It's a bit like a tattooist, you know, so if you've ever had a tattoo, they don't just stay in the same area, do they? They'll sort of move about. And it's these areas on Nick's hair that we've now seen. Have you seen the new growth already, Nick?
I think so. There's new baby hairs coming through.
Yeah, I can see them all across the scalp. Now when we get you in for clinic, you don't have to choose which treatment. It's all about taking your blood, and then obviously what we'll do, we'll deal with it and we'll put it wherever we can put it. So you end up having multiple treatments in the same session. So this patient is obviously having the hyperpigmentation treated, but also hair loss at the same time. Because it doesn't really matter to us once we've got your blood out. If we've used it for the reason that you're here, you know, we might as well use it for other places. So I'm just going to come down and just do the lower part of her face. And so this is now sort of replacing a skin booster. There's no pigmentation here, but this is what gives her the glow. And you find that you haven't had to use much makeup, is that right?
Yeah, I don't know, it's just better.
Just a glow,
it's
isn't it?
Better, yeah.
Just a glow, yeah. So it's the same sort of thing that you'd get from Profilo or a skin booster, but of course the good thing is it's your own blood. And because it's regenerative, once this is finished, she will be, her body will keep generating the goodness that we've put in her, which is just fantastic. You see the bright orange stuff down the bottom? This is the stuff we really want, but we have to be careful not to get any blood. So I've just got a fresh needle, and I'm just nice and really close to the blood. I'm just trying to get that bright orange stuff out. There it is. That's what I wanted. So you see that there? You see that orangey colour? That was what I wanted. So that is vibrant as well as PRP. So we're going to stick this on my hairline. Now the difference between PRP and PRF is all about the number of stem cells and the platelets in it. So there are more platelets and goodness in PRF than there is on PRP. And that's why dentists use PRF to make bone. So it grows bone inside your mouth if it's put on. But over here it's going to just react really well. So that's right at the bottom of that test tube. So that one's dead. We're now going to use the second test tube. So we've got another probably 4 mils of plasma that's come out of this. So we'll go and do that on the other side of her face. And then once that needling is done, what we can do then is use microneedling now. So when you first came, you had hundreds of injections, didn't you? Yeah, I mean, it was the first couple of sessions you have, if you're having this for pigmentation, it's a lot of injections, purely because we've got to get this deep into the cells. But once you're at the second or third, then it's more about microneedling. So we go down just under 1 mil on the microneedling. So we're pushing the blood down, and that's what gives her the glow. So you'll sort of see that happening in a minute. If there's any questions about hyperpigmentation, then please drop it down. It doesn't matter how bad the hyperpigmentation is, we can get rid of it in a number of sessions. What I'm doing now is I'm just treating this as a skin booster. So placing it into different parts of the skin. You'll see that I'm coming parallel to it, so I'm keeping away from all the arteries, all the nerves. just placing it under the skin superficially.
No, it doesn't hurt.
No, it's lovely, isn't it? It's a lovely treatment. And then into this hairline. So you're supposed to do the other side. We're now doing the left hand side. And the reason why I'm rubbing it all in is because really it's all valid. So it doesn't matter whether you inject it or it soaks into the skin. This plasma is gold. And it's completely pain free. I mean, you can feel the needle, I suppose, but
Someone said, is it GRP?
it's PRP and PRF. So we're using two types of centrifuge to generate the two types of blood. So PRP is what people tend to know a lot of. PRF is what the dentists have used for years. So it's very common for growing bone. It's used for skin grafting. So we're using both, and the reason why we use both is because the PRF and the PRP will work together to create like a matrix. So it sits inside the skin and then the PRF just builds on top of it, and you end up getting a super result. So I'm just doing a hairline, just give her face a rest. So you can see that you get a huge amount of mils for your buck. So I must be up to about 10 mils of plasma now, which is really
How much
good.
is this?
So it's £495, and that gets you a couple of sessions for hyperpigmentation. It depends on what we're doing. If you message us, we'll obviously tell you what we'll do, depending on what you want. If it's for hair growth only, we do a slightly different plan. So hair growth only, you can just pay monthly, and you come and have your hair done over a number of times across the month, and we give you shampoo to take away. The reason why we're including hair into Nick's today is purely because we've got enough blood to do, because this is her 4th session. What we're doing now is replacing skin boosters. So this is instead of Profilo or polynucleotides, we're just placing that superficially in the skin, which is fantastic. And again, I'm getting close to that orange stuff right at the bottom of the vial, and that's all the goodness that we want.
Oh, there's a few questions.
Yeah, what was the question?
I don't really know what that says. One says how much for marionette lines.
Oh, marionette lines. So if you're having filler, one of the best things you can do, if you can pay £180 per area. So if you wanted marionette lines, which is these ones here, then you could pay £180 for that. But to be honest, if you're coming to have your blood done, I would pay the £495, and then you can basically have your whole face done, because just doing that area is fine, and it would look like that. So you can see how that would lift. But why would you just do that? Because you might as well do the nasal folds at the same time, and maybe do a bit of skin boosting. And all of our hair at a certain age, you want to try and boost it up. Okay, so we're going into the areas that we would normally Botox, and this will give her that tightness of Botox, gets rid of all fine lines. The good thing about this, compared to Botox, is we don't really have to worry where we put it, because it won't cause any drooping eyelids or any raising of eyebrows or stuff like that. And there's that goodness again, look, right at the bottom. See this orangey colour stuff here? This is a bit that we really want. And there's 100 times more growth factors at the bottom of this vial than there is at the top. So you want to try and grab it all. There's a bit of a skill to get out, because you're literally right where the blood is, and you don't want the blood. You want just this bit here. So it's quite tricky. One more attempt to get that bottom of that blood out.
Why are you doing the eyebrow
So we're doing the eyebrow to tighten that area up and also to grow the eyebrows. So this will help with eyebrow growth and also just tighten that lower part up for her, so she hasn't got to use Botox and just stop any sort of wrinkles like that. So that's why we're doing that. I'm just going to do the upper part now of her face. So this is just to replace Botox or help with like skin quality. I mean, I can't remember the last time I did your Botox. When was the last time I did your Botox? No, I can't remember either. And that tells you really that how good this is, because we've been doing this as part of her skin, and you can see she's wrinkle free. But the good thing is she's still got movement, you see. So unlike Botox where you're frozen, this is a lovely treatment because you get the benefit of it without putting tox in you. It also means you can go to other places as well, so you can come up like close to this part of the eyebrow or over here, which is really good. So that's all the injections done. That's the hard bit done. We're just going to wipe her clean, and then we're going to start microneedling, which is the best bit. You like the microneedling, Nick, don't you?
I do.
The microneedling is the best bit. I tell you, I've can't believe the difference. What is this? So this is a treatment for hyperpigmentation. So what we are doing PRP, PRF. We are injecting, and we're about to start microneedling into just deal with hyperpigmentation. So Nick's problem was here, here, and here. So she had issues here. She also had very thick lines coming down each side of her face. So we've used her blood to get rid of the hyperpigmentation, and if she smiles, rather than having filler here, we've used her blood as filler. So she's basically, we've treated the pigmentation and the lines all in one go.
No, it doesn't hurt.
It's pleasant, isn't it? I mean, you feel the needle a little bit, but it's pleasant. It's not going to ever cause you any issues. So we've got one vial that I'm going to let Nick take home with her, because I want her to do something at home, and I'm just going to take this last vial and we're going to microneedle that for her. So I've got about 3 mils of plasma which we can use. So I'm just going to change my needle, get my gloves on, and then we will start. Now when you're microneedling, you can choose what depth you go to. For plasma, it's recommended to start at 0.2 and then build it up. Today we're going to go 0.75 on her face.
So how long does a plasma keep?
So when you take it home, as long as you leave it in the fridge, you get a good week out of it, and that's what I'm going to want you to do, Nick.
And how much is the cost?
So for your whole face it's $4.95, and that includes any fillers that you need. So when I say fillers, I mean your blood as fillers, to treat your whole face for hyperpigmentation. And you can buy a course as well. So this is the plasma, and then this is the microneedling that we're going to use. So we're going to set that to 0.75, between 0.75 and 1 mil, 1 millimetre.
495. Yeah.
495. I'm just going to put this back a little bit so you can. So what we do when you're microneedling, we put just a little bit on the areas that we want to microneedle, and then switch it on, and then we can choose the level of not just depth but also speed. So I'm using a really slow speed at the moment because I just want to be really accurate. The hardest thing of this treatment is using your left hand for the syringe. I find it incredibly difficult. And there's 42 needles, so we're using a 42 pin needle for this part of the treatment. So just spraying it on, just moving it about. And this is completely painless. So when you go home, Nick, I'm going to give you, because Nick's got a microneedling set at home, so we're going to give her some plasma to take away, and I'm going to get her to do this in a few days.
Just a bit looks like plastic.
Well, her
It
face,
looks like plastic.
your face
I'm not
probably.
sure.
I don't know what you mean. Do you mean her face? Because it certainly is tight and it certainly is glowing. I mean, if you look at, as we do this microneedling, if you look at one side of her face, when I get going onto the other down the side, you'll see how one side is glowing and the other side isn't, and that's the beauty of this. So,
As I said, I need some cheekbones back. Out loud. Do you have access to younger serum than my own?
younger? No. So if your plasma's no good, so if you're of an age, I mean, we have found that some older patients we have to use placenta. So we've got access to placenta, where if you think about what placenta does, placenta looks after the baby during pregnancy, so we can use that for both injecting and microneedling if you can't use your own plasma, but there's nothing quite like using your own plasma, to be honest. You see, we're just covering the area full of the plasma and just working our way through the face to just get all that in, and you can start to see how it's lifting the face, getting rid of any lines.
How much is the placenta?
Placenta is 195. You'll need 2 treatments of it. It's fantastic. It doesn't have smell though. Have we used placenta on you yet?
No.
So, I mean, you know that old saying of you are what you eat?
Yeah.
Well, obviously it comes from Korea. And where they eat spicy food and chicken food, it smells like sweet and sour chicken. It's the weirdest thing ever.
How many times should we do?
What's that for? Placenta? Is that the same person asking placenta?
No, it's something else.
For hyperpigmentation. So for hyperpigmentation, you're going to be with us for 3 or 4 goes. If you're coming here for lifting or fine lines, then it's once, and then maybe another go in 3 months. Once it's done, it will keep regenerating. So the reason why we've injected this as well as microneedling it is because we want the plasma to work itself at cell level. This is the area that's got the most hyperpigmentation, so that's the area that I want you to work, Nick, when you go home. You can see how it's also creating volume in your face. Have you noticed that, Nick?
Yeah.
Yeah. So rather than having filler in, you're getting natural plumper skin. I mean, we were at I don't know if you saw the lives yesterday, but this PRP, right, is amazing. So we went to meet an orthopaedic surgeon yesterday in Harley Street, who's taking PRP like this and actually creating it to help with erectile issues. So if a man has had cancer or a woman's lost her libido, we can take PRP, inject it into the male penis or into the woman to get her libido back. I mean, it's just amazing. What we're starting to notice now during 2024 is that more and more medicine has been found that PRP will solve. So 2024 for us was a big year because it gave us the first time to put it into knees, so to help with arthritis. As you know, I've had both my knees done. 2025, there's talk about it being used for skin grafting and for diabetes. And then to meet this surgeon yesterday who's taking this stuff, so it's no different to this, taking this stuff and injecting it into a male penis to help them get more erect or to stop premature ejaculation, and for women to build the G-spot back up again. I mean, it's marvellous because, you know, as you get older, some of those sensations do disappear, and, you know, the work he's doing is just incredible. It's all been designed and discovered by doctors in the US, and is slowly making its way over to the UK, which is really good. Any other questions, Nick?
Someone asked if have I had Botox.
Yes,
No.
she has, but not today. not today. And we were just discussing that because we can't remember the last time you had your Botox, can we? So if you just joined us on YouTube, welcome. We're doing live on clinic today on hyperpigmentation, and the only thing you've missed is the injections. We're now just working microneedling into her skin at 0.75, and you can start to see how her skin is blossoming, absolutely glowing. How tight is it?
Yeah, it's tight.
It's really tight. So just bear with me a second, I'm just going to rub all this in. So the reason why we rub this in is because we want to keep everything, okay? So I'm also feeling for any of the injection points to make sure that they've settled, which they have. You might get a little bruise there, Nick. That one I think I couldn't help. But the rest of it's all gone in lovely. It's super smooth. The blood, yeah, it feels really good. Does it feel tight?
Yeah.
Excellent. So we're just going to microneedle her hair now. So when we do microneedling on the hair, just change my gloves. What we're doing is we're just trying to create a larger space to sort of move the plasma around. If you just joined us on YouTube, welcome. We're just showcasing some live treatments today. This is for hyperpigmentation. We were just also talking, if you've just joined us, about how we met a surgeon yesterday who's taking PRP and using it for penile issues and vagina issues. I mean, this is just, you know, just amazing, don't you think, Nick?
Yeah.
I mean, you're sitting here having your hair done, meanwhile somebody 17 miles down the road is injecting it into a man who has lost his libido because of cancer, and it's the same stuff, you know. And I think to myself, it's amazing. And probably up and down the country, there's in hospitals and private clinics, there's people having this PRP stuck in their knee to get rid of arthritis, and I just find it fascinating, because we don't know about it because the farmers don't want us to know about it. So, you know, the big pharmaceutical companies are really scared because all of a sudden we're starting to see that we can take blood, and the only difference between what we are doing here and what that surgeon is doing in Harley Street is not the consistency of the blood, it's the technique of putting it in. Do you understand what I mean, Nick? So, like, obviously what we're doing here, we're using a certain technique for hair and for skin. When we do knees, we use a different technique, and obviously what he's doing, he's using another technique to stick it into the penis. But the results are staggering. And then I met another surgeon the other day, and he's involved in skin grafting after amputation, to stop amputation. So one of the things that tends to happen if you're diabetic is you might end up losing a foot or a hand or an arm or a leg due to diabetes, and instead of chopping it off, they're using PRP to do it. So yeah, it's amazing.
We've had a couple of questions.
Go on.
Been doing more lives today.
We're going to do a couple of talking lives. I don't know what's on today. It all depends on who's coming in. Also, the other problem I've got is Bina's away today, so trying to do live on TikTok, live on YouTube, and look after my patients, it's a bit like spinning plates.
What is the blood mixed with?
Nothing. So the only difference in the treatment is going to be the way it is spun, so the speed it's spun at and the way it is put in. So what I'm going to show you, we've already decided this, as Nick will tell you, so I'm not reacting to the live, but we are going to stick the placenta in you, and where I'm going to target the placenta is here, because with the hyperpigmentation, it's this bit here that hasn't gone. So what you see there, this whole side of the face was that colour, that dark brown. And you can see we've dealt with it here, but we haven't dealt with it as much there. And on this side, it's virtually gone. So I want to use placenta today in an attempt to try and kick-start that part of the face. So for those who were asking about using somebody else's plasma that's stronger than yours, this is what I'm about to do. So this is it. it's straight from South Korea. So in here is placenta from an O plus or an O positive baby. If you watched the live yesterday when Emma and I were talking about the blood type diet, so with a zero, an O negative or O positive, they can give their blood and they can also give things like their placenta. So in here is all the nutrients from the placenta, from that Korean baby, and that's what we're going to inject into the face. So you can imagine how, no, it's not someone else's blood, it's somebody else's nutrients from their placenta, okay? So it's obviously in a very controlled environment. They don't just drag them off the street. Now, in Korea, they've been doing this now for 35 years. So I was, we have a lot of contact with the doctors over in South Korea. And when we met them for the centre, I said to him, I said, oh, how new is this? And he just laughed at me and said, we've been doing it 35 years, as if we were from a foreign backward company. But it just shows you how backward we are in some ways. I've got a few patients that are midwives, and you know what they've told me is that we just try and throw it away as quick as possible, whereas really what we should be doing is using it for things like this. Now, I wish this was smelly vision, because I can't wait for Nick to tell you what this smells like. Huh? Okay. So, just bear with me. Oh, sorry, back. So what we're going to do, we're going to inject the placenta into that area. So if you just put it to the side, you see this brown mark here, this is the placenta that we're using. So the reason why I'm putting this in is because Nick's blood just hasn't shifted it. So we're going to use this as an attempt to shift it. You smell it?
No. Yeah.
It's like chicken, isn't it? Excellent, so that's gone in super. And then what we'll do, we'll microneedle the rest through her face.
Is that someone else's blood?
It's somebody else's placenta. Huh?
I don't think they like it.
They don't like it, no. So this is placenta. So this has come from a baby, that obviously from Korea. And you see that smell? Mm-hmm. It smells like chicken, doesn't it? Yeah. So, we were talking yesterday on live that you are what you eat. And I think that just about sums it up for me, because obviously they eat different food in South Korea, and you can physically smell it, can't you, Nick? Mm-hmm. It just has that smell. But the goodness in this is unbelievable. Now again, okay, so going back to what we were saying with PRP earlier, what people are doing with placenta is they're injecting it into joints to regrow the stem cells. They are sticking it into areas of arthritis to deal with it. Now what you've got to remember is, and again we covered this on the live yesterday, if you are an O positive, then your blood is used in any sort of position. So if you have a car accident and you have to be given blood, you'll be given somebody else's O positive or O negative, because there's no time to check your blood. You can't do that with anything else, so you can't put an AB or an A into someone's face or whatever. But what we're doing here is using all the nutrients from the placenta. It's amazing, absolutely amazing. And Nick will be back in a couple of weeks, so you'll be able to see the changes to Nick. And the placenta we're using it for the first time in her treatment plan, purely because I think this is the last time we're going to see Nick. apart from obviously doing some top-ups, I have a feeling that once that placenta is in, then this part of the pigmentation, because you can already see, look, you see how that's lowered, Nick? I don't know if you can tell, but see how the colour's changed?
Yeah. I can't see a problem there.
See, it's just changed. So it's quite amazing already from doing it, how much that has changed. So I'm going to clean her up now. I'm not going to do much more than just use a sterile wipe to just clean her up, because I really don't want to take any of that blood or that placenta off her face.
Is there a risk of infection?
No. Well, there's a risk of infection with everything that you do, and that's why it's important that you choose the right practice. We are not far away from getting CQC. So CQC is the registration that hospitals and doctors and clinics have to have. We've put all our paperwork in, we're just waiting for our second inspection. And they've come in and inspected obviously our practices, our hygiene, and what we're trying to do. So, but yes, there's always a risk of infection. Not from the placenta, definitely not, because obviously it's all controlled. Now her face is red hot. Does it feel hot?
No.
No, it really is hot. But that's her done. So normally we would tidy that face up, as you know, but I just really want to leave that like it. The only danger I see is a bruise there, unfortunately, but apart from that, it's gone in super. So when will this redness go down, Nick?
Probably in the next hour.
Yeah, so every patient's different, so that's why I'm asking her. But you can see how it's lifted that face again. It's quite amazing.
Mhm.
You've got high cheekbones.
Yeah.
I remember when you first came and you phoned us about 24 hours ago, oh my God, I think there's something wrong, because her cheeks were really massive. And that's obviously one of the benefits of what we're doing, but yeah, it's getting better.
Yeah.
Perfect. So that's us done. I'm sorry that it's not as smooth as normal, but obviously with Bina not here, it's hard to try and do everything yourself. We're going to say goodbye now. I'll be back on soon because I'm going to do some talking in a minute. But until now, we'll see you soon. Take care. John Nick. 3,500 people are going, they love you, don't they? Huh?
Is the other one still?
Yeah. So thank you for joining us. We'll be going live again very soon. So if you want to make a tag and see where we are, we're based in Brentwood today, but we're all over the Brentwood and West London. So please keep an eye out for our next live.